Mang-Yee till midnight on 104.7 The Drop, Denver's Urban Alternative. We've been telling you all week long that we were due for a very important conversation. I've got Mr. Dexter Brooks here with me from Connect for Health Colorado. How you doing this evening, sir?
Doing great. How you doing this evening?
I'm good. Thank you for joining us. This conversation is going to be a super important one, as there's lots of things we're going to talk about this evening that I myself wanted to know about. It is open enrollment season, and things are a little bit strange this year, aren't they?
Things are really strange, mainly because we have lost the extra subsidies. We are now back to the original subsidies that were there prior to COVID.
Okay, what does that mean for the people that don't understand that the tax credits were the reasons?
The tax credits, correct. So basically the tax credits have now reverted back to the original tax credit before COVID. When COVID was enacted, the government actually created a new bill that lowered the tax credit extremely low. So a household of four could have got a premium probably for around $120.
Okay.
Today, that tax credit is gone. So today, that bill is eliminated. That's why the government is shut down, and we'll touch base on that as well. But now your premium, if you're a household of four, you're looking at about $2,000.
Oh, my God. Really?
Really.
$2,000. So this is like 100 times.
That's correct. It is overwhelming. But as a broker, we are here to assist everyone and to assist them in finding a lower premium. We're going to do everything we can. We're also asking people to go into the marketplace, look at their current plans, and contact a broker so that we can see exactly where you are. We're also asking people to probably wait a little bit before they submit.
Okay.
Because Congress is out. They are shut down. We're waiting for them to negotiate.
They got to make a deal.
So we're hoping they're going to negotiate before the holidays.
Okay, for our friends that don't know, what is Connect for Health Colorado? And then we'll jump back into...
Let's explain how this works.
The politics.
Yes, we have Connect for Health Colorado, which is a state marketplace in Colorado. We have healthcare.gov, which is the federal marketplace.
Okay.
So states either have a federal or they have a state marketplace.
Okay.
So when you're shopping, you want to make sure you go to Connect for Health Colorado. There's a lot of dummy websites out there, and if you click on one of those dummy websites, you may get spammed.
Oh, no, or got. You may get got
for
that $2,000 that you're trying to use to pay for your health insurance. Okay, so we are officially in open enrollment season. It kicked off the 1st of November, and it goes through the 15th of January. Tell our people why these dates are so important.
So look at it this way. So first of all, the open enrollment did start November 1st, but you have until December the 15th.
Okay.
To enroll if you want a January 1st effective date.
Okay.
After the 15th, then you will receive a February effective date.
Okay.
If you do not enroll by January 15th, you are SOL.
Oh, my God. And I think a lot of people don't understand that once this enrollment period is over, there are only certain circumstances that can occur that will allow you to change your health insurance. For example, a birth in the family or a divorce, a marriage. So these are the instances.
Absolutely. But
for the rest of us, 1 through the 15th of January or 15th of December, if you want that 1 January effective date. Tell me about the different plans. Like, I'm not the most educated in what plans. I have 3 children, and I'm a single mom, so maybe we could use me as an example for our listeners.
Let's look at that. So we have a single mom, 3 kids, and we're just going to give an example. Depending on the kid's age, Colorado may place them in Medicaid.
Okay.
Because Colorado is great for that. That's a plus for Colorado. But then we'll look at the income, and then the parent would most likely enroll in a bronze plan, or a silver plan, or a gold plan. The difference between those plans is your bronze plans have very, very high deductibles, but they're also HSA compatible starting in 2026.
Okay.
The silver plans are your mid-level, and then your gold plans are your lower deductibles.
Okay, so this is all through Connect for Health Colorado.
This is all through Connect for Health Colorado. You're going to notice when you do shop, the deductibles have jumped up to $10,000 for 2026. But if you get a tax credit, that deductible can be reduced down to $2,000, maybe $1,000.
Okay, so that's what we're hoping, that the government reopens and that they implement, hopefully, the extension of the bill that has pretty much saved all of the country in premiums.
Has saved the whole entire country. You're absolutely right.
Okay, what if somebody doesn't understand these things? Is there specialists that you guys have that we could call?
So whenever you're shopping for insurance, when you go to Connect for Health Colorado, there is a link on the page that says Get Assistance.
Okay.
Get assistance from a broker. Get assistance for an assistance location. When you click on that, it's going to actually allow you to plug in your zip code. It will connect you with a broker directly in your area who is licensed, certified, and trained to assist you.
Okay, so they'll help you choose a proper plan according to, I've got 2 kids, I've got 10 kids, I'm single, I'm married.
True. And here's the key to that. There is no charge. It is free of charge.
Oh, man, that's good to hear. I was really proud of Colorado. You saw that they voted this week to keep the free meals for all the students in the state. And you know what? We're one of the only states that have a measure like that in place. So I like living here for reasons like this, and this also is going to be so beneficial to so many people that right now are dealing with the loss of the SNAP benefits. Hopefully those will kick back in by tomorrow, like it was mandated.
Like my agency, which is HealthNet Co. Insurance Agency, we assist in 28 states. Colorado has the lowest premiums of all the states when it comes to insurance. Yes.
Wow. Okay.
Colorado does a great job when it comes to insurance.
Well, I feel like as expensive it is to live here, that we get a we get a break somewhere. Okay, man, I'm here with Mr. Dexter Brooks. We'll be back after a couple of songs to speak more about Connect for Health Colorado, a couple of the different plans, and where you can enroll. Keep us locked.